Welcome to this presentation on assessment techniques. As an RT professional, you will need to utilize a variety of different approaches to gather the necessary information based on the needs and limitations of the client. For example, if your primary method is to complete an interview and the client is hearing impaired, you will need to adjust your information gathering techniques. Conversely, if normally you supply the client with a survey to complete, but the individual is visually impaired or illiterate, you will need to change how you assess that individual. The techniques used in assessment include interviewing, observation, self-administered surveys, and secondary sources. We will start off this presentation with the most widely used assessment technique among healthcare professionals, the interview. As it implies, this is a face-to-face interaction with a client where a series of questions is asked to acquire a holistic picture of the client. In today's healthcare arena, interviews may be occurring in non-traditional fashions, such as with a phone call or by using a telehealth video conferencing platform. It is important to remember that face-to-face does not necessarily mean the client and the provider are actually physically in the same space. The advantages of the interview is the depth of information the provider is able to gather from the individual. There are two approaches to structuring an interview. The first is a direct approach. This is where the provider has a specific set of questions that will be asked to gather the information. The non-directive or client-centered approach is less structured, and the client directs the flow of the interview. It is important to consider things that could influence your assessment interview. For example, the time of day, the environment, the setting, your appearance, and medication side effects can all factor into the effectiveness and flow of the interview. For example, if you are working on an acute rehabilitation unit, and the client had a total hip replacement yesterday, pain management will be a valid concern for the client. If you are trying to complete an assessment and the individual has not received their medication in 4 hours, it could influence the client's ability to move, willingness to participate, and overall attitude. Other things to consider are to make sure you are creating an environment of openness, warmth, acceptance, and comfort. As an RT professional, you may be on the very tight time schedule, but that is not the patient's issue. Building rapport with your client is a vital skill for the RT provider. Spend some time on how to structure your interview. It matters. Interviews typically consist of 3 parts: the opening, the body, and the closing. The opening section is used to set the tone for the interview, allows for formal introductions, and an orientation to the recreation therapy services. This is key to building rapport and trust with your clients. If you enter the room without knocking, it will give the impression that the client's privacy is not important. Also, if you storm into the room in a frenzy because you have to get this assessment done before your next group, the client will feel hurried and unimportant. Just like all interactions, first impressions are very important. The meat of the interview is referred to as the body section. Typically, this is structured in a logical fashion to allow the therapist the ability to acquire the necessary information about the client for placement into appropriate programs. Even a client-centered interview approach needs to provide the therapist with the essential information for program placement. This concept was discussed in the previous presentations. Normal information gathered will cover the relevant life domains and include background information on the client. The final phase is the closing. In this section of the interview, the therapist provides a summary of the interview to ensure comprehension, discusses the assessment results, develops goals and objectives for treatment, provides the client with a treatment plan or schedule, and of course, thanks the patient for their time and participation in the process. Always remember that just because you are required to complete an assessment on a patient, the patient has the choice in participating in treatment. Listening is a skill. Often we are hearing, but not listening. We hear so we can respond. We listen so we can connect. If you are interviewing a patient and you are unclear about something, ask. Seek complete comprehension by using communication techniques such as clarifying and probing questions. Use mostly open-ended questions to encourage your interviewee to elaborate. Closed-ended questions will make it a major challenge to gather the information. Employ an attitude of acceptance, empathy, and non-judgment. This is true in all situations. Being non-judgmental of your client does not mean you agree or condone with the client's behaviors or actions. Lastly, always work on reframing from making an assessment until you have gathered all the information. Depending on the client, interviews can be the most effective and time-saving tool a professional has to gather information. However, there are a few things to consider. At times, clients will provide the responses they think you want to hear. Kind of like when people go to the dentist and claim that they've been flossing daily. The dentist will know the truth, but the patients still want to please the provider. Another phenomenon is social facilitation. This is when a client parrots or mimics the behaviors or words of the therapist. It is very challenging to gather information when the client is only repeating what you are saying. Observations are used to record the client's behavior. This is typically a systematic method with standardized procedures by which formal information is targeted, recorded, scored, and interpreted. The downfall of observation is its inability to assess the client's interests, attitudes, or knowledge or meaning behind their behaviors. The therapist will be unable to determine the underlying feelings, thoughts, or motives. It is simply, did the behavior occur, how long was it, and how often. There are 4 observational techniques. These are frequency or tallies, duration, intervals, or instantaneous time sampling. When the therapist wants to know how often a behavior or action occurs, the therapist would use frequency or a tally approach. For example, your course instructor may want to know how many times a student uses filler words during a course presentation assignment. These are words such as like, so. The instructor would simply place a check mark or dash on a piece of paper each time the student uses a filler word. At the end of the presentation, the instructor would add up the marks and have a total. The same can be true for any behavior a person wants to record. When a therapist wants to know how long a behavior lasts, they are recording duration. For example, if a client has behavioral temper tantrums and the goal is to increase the length of time for each episode, the therapist would start recording the time when the tantrum starts until it ends. Recording the individual time allows the therapist to assess if the length of the temper tantrum episodes is decreasing. Interval technique is used when the provider is concerned about both frequency and duration. Lastly, instantaneous time sampling are observations made by an observer who is periodically entering and exiting the area. In this case, the therapist might want to know if their presence makes a difference in the client's behaviors. In some situations, the therapist may still be able to observe from outside the area before re-entering the space. There are a couple different methods for recording observation. Checklists provide a structured, standardized method for recording whether a characteristic is present or absent, and are very useful for assessing mastery of concrete learning tasks, performance skills, or finished products. Rating scales are structured and standardized, similar to checklists, but can indicate the degree or severity of the characteristic or action being recorded. Anecdotal records or incident reports can provide a narrative of factual descriptions of actual behavior, and these reports can be about typical or atypical client behaviors. Observations can be very helpful to assist in documenting client behaviors. There are a few things to consider. It is essential that the provider is concretely defined the targeted behavior to be observed. There should be no question as to whether or not the client has performed the observed behavior. This uncertainty can be eliminated by developing a protocol that clearly defines the procedures for observing, collecting, organizing, and analyzing data, and clearly describes under what conditions will the behaviors be observed. The therapist would want to spend time developing a tool that will be used and included in the protocol. The clearer the parameters of the observational technique, the less likely for poor inter-rater reliability, observer bias, or observer drift. These concepts are discussed further in the assessment theories presentation. As a provider, you will want to ensure the tool is concise and descriptive. Always remember, if the setting is unnatural, then the client's behaviors may not be valid. That does not mean you should not perform the observations. It just means that as an RT professional, you need to take these things into consideration. A great example of this phenomenon is children at home versus in public. Often children are better behaved and less disruptive in unfamiliar. Along with the interviews and observations, there are two more assessment techniques to cover. The first one is performance tests. Performance tests are typically used to measure and evaluate physical functioning. These tests are normally completed within an established setting, such as a physical therapy clinic or the patient's room, and has a targeted performance criteria for the skill being tested. Examples of performance tests include: can the client stand from a seated position? Are they able to transfer from the bed to a chair independently? Or how far can they walk with or without assistance? The final assessment technique is the utilization of secondary data sources. This can have a variety of different names depending on the book you are reading. Some will refer to this as a record review or a chart review. Please note that these different names are all referring to the same assessment technique, which is essentially the use of information in an assessment process that is not gathered from the patients themselves. Secondary information might come from family members, information obtained from the patient's medical record, or even your personal past experiences with the client. It is always best to acquire the information directly from the patient, but there may be times when secondary information is the only information available. For example, if the client is in a coma and unable to directly participate in assessment process, then contacting family or doing a chart review for information on the client is appropriate. Maybe the client is awake and unable to participate in the process, but is refusing at this time or is unwilling. This could be a direct result of the admission condition, such as dementia or paranoia. At this time, you would want to seek information from family members or the chart. It is important to evaluate the validity of the information you are collecting from other sources to ensure that you are gaining the best and most valid assessment of the client. If the client's status changes, such as they can now participate in the assessment, I would encourage you to complete either a full reassessment of the individual or at least check to fill in the missing information and to ensure the information gathered was accurate. I wanted to end this presentation with some food for thought. Although these were presented individually, a good therapist will use a multiple technique approach. Integrating more than one assessment technique can help ensure a holistic viewpoint of the patient and can provide you with both quantitative and qualitative data. Good assessments include both forms of data, numbers and words. Always have a protocol. This increases the validity and reliability of your assessments and makes it easier to train staff and students. Continually work toward improving the process and tools. Update these as needed and review at least on an annual basis. You may not be able to control the environment and how the client will respond, but a good therapist is always concerned with ensuring they are attempting to complete assessments in a fashion that promotes the highest level of validity and reliability. No matter what, use this assessment time to connect and build rapport with your patients. You will see a difference in their experience, progress, and willingness. The assessment process can seem arduous and taxing at times, but our attitude and approach will make a difference in our clients' recovery.